Hello, this is Andy Malekoff. I'm the Executive Director of North Shore Child and Family Guidance Center, and this is Guidance Center Perspectives on Pandemic 2020. And today we're going to be talking about postpartum in the pandemic. And my special guest today is Vanessa McMullan, and she is a licensed clinical social worker with the Guidance Center and specializes, in addition to early childhood, with postpartum depression, which is also known most recently as perinatal mood and anxiety disorders. But you'll hear a lot more about that as we go along. So welcome, Vanessa.
Thank you.
And to begin with, can you talk about, what does that mean, postpartum depression, perinatal mood and anxiety disorders, to orient everyone who might not be as familiar with this?
Okay. Perinatal mood and anxiety disorders has gotten a lot more attention recently in looking at women who are struggling with either symptoms of depression or anxiety during their pregnancy or in the period of time for about a year up after the baby is born. It's a very difficult time for these moms. And typically being pregnant and having a baby is, a joyous experience. Women and families are eagerly anticipating that. And parenthood is really wonderful in a lot of ways, but we also know that it's very stressful.
Right. So as stressful as it is under normal circumstances, now that we're living in the pandemic world, COVID-19, it must be extraordinarily more stressful for these women, these moms, and also the families.
Yeah, absolutely. I mean, I think we've all been impacted by this pandemic. And if we think about how much we've all been impacted, imagine what it's like for families who are either expecting a baby or home with a newborn or an infant. So, if we look at the postpartum period in general, we know that it's physically, mentally, and emotionally exhausting. So when you combine that with the hormonal changes, the mom's recovery from labor and delivery, sleep deprivation, and lack of self-care, it can really be an unmanageable situation. Some moms, not everybody struggles. Some moms really have an overwhelmingly positive experience in transitioning to motherhood. And other times it's, people I think use the term the baby blues. That refers to that, period of like 2 weeks or so after the baby comes, where there's maybe a lot of crying or, irritability and uncertainty until things sort of settle down a little bit. But we become more concerned when those symptoms don't go away. These moms not only are not enjoying this time that they were really expecting to enjoy, they feel like they can't even function some of the time. So I just want to list a few symptoms of perinatal mood and anxiety disorders briefly, so that if anyone is struggling or feels like they know somebody who might be struggling, it's important things to look for.
Before you do that, I just wanted to emphasize something you're saying, that the baby blues, as you described it, being a little teary and, irritable and so forth, that's something that happens in normal situations.
Yes.
And it's not necessarily a symptom or a sign of something that's more serious. But when you're talking about maternal depression, postpartum depression, perinatal mood and anxiety disorders, you're talking about it moving from what a mom might feel under normal circumstances to an area where there's very serious concern, and that may require some kind of mental health intervention.
Right. Yeah. I mean, it really exists on a range. We look at that 2-week period as, expected difficulty in reaction because it's such an overwhelming time and so many things are happening physically and emotionally. After 2 weeks, if those symptoms don't subside and a mom is continuing to feel depressed or disconnected or hopeless. Those are things that we really want to pay attention to. It's estimated that about 1 in 7 women develop perinatal mood and anxiety disorder. It's believed the numbers are higher because a lot of moms don't report, but this actually makes it the #1 complication from childbirth is mental health struggles after the baby comes. So we want to make sure we're reaching as many moms as possible to know that they're not alone, because it is more common than people think. And women don't necessarily want to share that they're feeling that they don't love every minute of motherhood or that it's harder than they expected. So there's a lot of shame and suffering and silence for these women.
So it's almost like there's a, this is a term I've heard used with other situations. It's almost like a conspiracy of silence because, you're supposed to have the greatest time in your life when a baby is born and
Yes.
love and all of the things that you expected. And then all of a sudden reality hits and that's not your experience. So you don't want the rest of the world to know that you're not enjoying things like all the other moms are, so to speak.
Right. There's a lot of judgments. And usually, self-judgment is the worst. And where they'll say something to maybe their partner and their partner will respond in what seems to be a supportive way, but, maybe mom feels invalidated. So it's just a hard time for everybody to navigate, emotions and again, the responsibilities of caring for a newborn, which are tremendous.
Yeah. So you mentioned the partner and, the partner also has expectations. And when this happens, for many, I would assume, you can tell us, but for many partners, it's just they're incredulous that this is happening. Like, how is it possible that you can't be in love with this baby and you can't be happy? What's wrong with you?
Right. Look at him. He's perfect. What are you're doing such a great job. And those are well-meaning thoughts, but they're usually not what the mom needs to hear. And sometimes mom doesn't even know what she wants to hear. Sometimes the mom is just so sleep deprived and, maybe trying to figure out how to breastfeed and get the latch correct and, worried about doing everything correctly, that nothing is really able to alleviate that anxiety. So it becomes a crisis for the whole family.
So, I always like to say that with all the matters we speak about on this program, that context counts. And so what that means is that, you're not living in a bubble, you're living in the world. And when events occur in the world that have, a rippling effect across cities, states, counties, the world for that matter, it impacts on everyone. And so here we're living in this pandemic world where people are anxious, uncertain about the future, fearful, not necessarily fully aware or educated about what the implications are of becoming infected with COVID-19, different reports about, little kids and young people don't really have an impact, but then you hear stories about certain diseases that are evolving in certain kids. There's concern about infecting older people in the family, and I'm sure that, for every family, when a baby is born, the grandparents can't wait to be there. And so, so the world has a real impact on what's happening. So what is the impact of COVID-19 on these families, these women who are living with and suffering in a sense with maternal depression and mood?
Sure. Well, like as I said in the beginning, this is such an exciting time in a lot of ways. So moms are looking forward to things like baby showers, registering, sonograms, having the family in the waiting room at the hospital, eagerly anticipating the baby's arrival. And so many moms didn't get that experience this time. Some of them feel gypped by it. or they had the experience, but it was, riddled with stress and anxiety and like, okay, is it worth it to get people together for a baby shower, during this time of, before all the restrictions and things had come into place. So the happiness that sort of balances out some of the stress really, I think didn't happen for a certain period of time for a lot of moms. And that was hard. And that carried over into, doctor's appointments and things. There was a time where there was not allowed to be a support person. You could no longer have your partner coming to the OB with you, or, coming to the sonogram. And, whether moms were getting exciting news from the doctor or, tough news, or just trying to make plans, to have to process that on their own because they weren't allowed to bring somebody with them was really, upsetting, and led to significantly more anxiety about what the delivery and labor were going to look like. There was a tremendous fear that moms were not going to be allowed to have somebody with them in the delivery room, because, there was those restrictions that were changing, and there was a period of time where you couldn't have any extra people, including a spouse or a partner. So there was fear about moms having to do it by themselves. They were panicked about their partner getting COVID or themselves getting COVID, because then even if the hospitals allowed a partner, absolutely couldn't have someone who was infected. And that meant maybe dad couldn't come visit the baby after they were born. Moms, were concerned about exposing themselves to COVID or their babies to COVID, just simply by being in a hospital during this time. They were concerned about being discharged too early because, the protocols were to get moms and babies in and out as quickly as was safe. So, we had moms with scheduled C-sections that were like, I'm going to be sent home after a day. How is that even going to work? So there was all of this buildup, with so many more factors exacerbating what's already a stressful situation. So you're going into this with a lot more, stress and anxiety. And we know that after the baby comes, all of that stuff increases, monumentally.
Yeah, it's what you're saying is really illuminating, because I've been so used to hearing about and talking about the impact at the end of life, when usually it's an older person goes into the hospital, and sadly in so many cases they have had to go on ventilators and then died, and in their last few days, their last moments, they didn't have somebody there with them. And you talk about the different rituals as well of baby being born, showers and so forth. And we hear a lot about there can't be funerals and wakes and shivas and the usual rituals, but I don't hear a lot. So it's really interesting about the other end of life. It's the alpha and the omega. We hear a lot of the omega, but we don't hear that much about the alpha.
Yeah. This was tough. This was something that a lot of women had waited for, and now it wasn't this typical experience that they got to have. So it was upsetting.
So I'm sorry. So at at the Guidance Center at North Shore Child and Family Guidance Center, we have the the Diane Goldberg Maternal Depression Program that's also supported by the Marks Family Foundation. And we're one of the only programs of its kind in the metropolitan area in a community-based mental health agency. So what are some of the things that we do in the program that is so important for moms and families that are in this this very difficult situation?
It's been an interesting transition to telehealth, because we have luckily continued to provide services to the families that we were already seeing before the pandemic happened, but also been able to connect with new moms who are struggling, in this particular situation. So we're hearing from moms about what this experience has been, and engaging them in therapy. So helping them process their anxiety, helping them adjust to this new role of mother while also all of this stuff is going on, and hearing about their stresses and trying to help them come up with concrete ways to get support and utilize family members in a way that, this plan is different. A lot of these families, the expectation was maybe grandparents are going to come and help, or families are going to come and help. And now people are staying away. So, what does that look like going forward? So we work with moms individually. We actually have a support group that's meeting right now for, moms with babies. It's happening virtually. We are, we continue to provide psychiatric services and medication management for the moms that need it. And we are trying to add in, when we're live and in person, we have a wellness program that we've really been building. So we're in the process of trying to get some of those wellness services virtual, because moms are continuing to struggle. And, there's an isolation that happens in that new postpartum period anyway. And, especially now, with quarantining and social distancing, there is a tremendous amount of, moms who have been isolated for the last few months, even maybe before they gave birth, because they didn't want to obviously expose themselves to anything before having the baby, but even after the fact. So, there's really minimal interactions with others. There, normally you'd have people coming by to do a check-in with you. That's not really, or that hasn't been happening. I know some of the restrictions are lifting now a little bit, and people are getting more comfortable. But with that comes concerns, because that's a typical part of new parenting, is setting boundaries with people, not necessarily wanting the baby passed from person to person. But now, in the midst of a deadly pandemic, parents are concerned. They don't want necessarily family members, friends, strangers, exposing them or their children in any way. So how to make that happen? So even something like a simple pediatrician appointment requires even more planning than it did before. So it's just a lot to consider on top of what's already required.
So one of the casualties of the pandemic in this situation is the kind of, I wouldn't call it the breakdown, but the unavailability of the support system, the
Yes.
helping network, the natural helping network that new moms and families would typically expect to kind of kick into gear.
Yes. And that had an emotional toll as well. Moms, that had just given birth sometimes wanted their moms, they were missing that piece for themselves also, in addition to the, excitement of mom or dad coming to meet their grandchild, or cousins coming to, see the baby that, everyone was waiting for. So it really impacted them emotionally, in addition to the lack of help, and then sort of having to manage everything on their own. Even things like, am I going to be able to get formula? Amazon's not delivering for 2 weeks. What am I going to do if I run out of diapers? I can't go to the store. So there was just this constant, level of anxiety, combined with, it was really, I think, a bombardment of information from the TV and, the internet and the media, which, in that time, I think it's typically hard, but in that time, trying to obtain and filter factual, helpful information, as opposed to, I think, most of what was coming in reports, which was scary, terrifying, and really overwhelming for these families.
Yeah. So what was anticipated as what was to be the most wonderful time in one's life becomes filled with internal strife and external chaos.
Right.
Yeah.
That's what the moms who experience PMADs go through, which is, again, this is supposed to be the best thing that's ever happened. This was something I worked so hard for, struggling with years of infertility, and I, don't like it, or I'm not good at it. But now with this pandemic, it it reached all families, whether they was, depression or anxiety or not, but certainly led to more moms, I believe, feeling depressed and anxious.
Yeah. So for the viewers, listeners out there, PMADS is short for perinatal mood and anxiety disorder. It's just
Yes.
the term that's used to make it easy, PMADS.
Yes.
So you mentioned something about wellness services. Could you say what those are about that you're going to try to introduce now, through remote counseling?
Sure. Sure. A big theme of what we noticed in ongoing work with this population is the lack of self-care. Moms are so busy and overwhelmed in giving to their baby, to their other children, and maintaining a house or having to work also, that they really put their own needs last, if at all. Even basic needs like eating, sleeping, time for themselves. So we were really trying to push to help moms give that time to themselves. So in person, we had done some mindfulness workshops. We're just starting with some yoga programs. And what we're hoping to do is offer maybe some workshops online in terms of healthy eating and, encouragement for moms to continue to try to take care of their health during this time. Maybe doing some sort of breathing and mindfulness and meditation and yoga through virtual, because it's not really high on the priority list. And I understand, because everybody is so overwhelmed and really just trying to get through the day. But offering, permission to these moms, it's okay for you to take 45 minutes to do something for yourself. It's okay to ask for help from someone to give you a break. I think there's the misconception that asking for help makes you a bad mom. It makes it look like you can't handle things, when we try to help them see the opposite, which is, in order to be the best mom you can, you have to take care of yourself, at least in some way, which doesn't come easy for a lot of women.
Yeah. So a lot of these wellness activities are in light of the fact that we're in this uncertain and anxious state, in this world where we don't know what's going to happen tomorrow, next week, next month, or next year for that matter. And to be able to be in the moment and to find ways to calm oneself and to soothe oneself and put the past and the future kind of aside, even if it's just for 15, 20, or as you said, 45 minutes, the practice of that and some of the skill in, learning how to take care of yourself in this way, becomes a critical part of the healing and the progression that the moms can make.
Right. And even engaging in therapy, giving themselves permission to say that this is what I need for my health, my mental health, to have a session. And I think the virtual piece has really helped a lot of moms, because, especially with a newborn, you're not, even before all this happened, you're not bringing a baby out to, public places. There's, a lot of recommendations, a lot of concerns. So being able to reach women in their home and, not necessarily having to go through all of the extra work and getting out of the house and packing up the baby and making plans, I think has led to, an increased comfort in just being able to connect in an easier way and let them know that they're not alone.
Okay. And so as great as Vanessa is in having this understanding and providing the kind of interventions that she described, that she's not a one-woman show, that there are other resources out there, and there are collaborations partnerships that we're a part of, because we do believe in partnership. And Vanessa has spoken at a lot of many large conferences and participated in different events with groups that have this population at the center of their mission. So could you tell our viewers a little bit about what's out there and what kind of connections there are to support women and families in these circumstances?
Sure. Well, one of the things that we're part of locally is with the Nassau County Department of Health, the Perinatal Services Network, where as a community, we're really looking at the needs of women and families and how to help, and understanding that the impact of maternal mental health has such significant considerations on the child, not just immediately in that newborn period, but really in terms of their development, in terms of their emotional and physical health. So really looking at things right from the beginning. So we're partnered with a lot of agencies throughout the county. If if there's a family who lives in New York State that's looking for help, we work very closely with the Postpartum Resource Center of New York. It is a fantastic referral source in terms of they have resources broken down by county, whether it's breastfeeding support, groups, individual therapy, motherhood wellness. They have it all throughout the state, and they have a warm line so you can contact them, and they really work very diligently, not just to give you a referral, but to connect you with a provider in New York State. So they are reachable at postpartumny.org. And then for women and families outside of New York State, I would recommend the resource of Postpartum Support International, which is, this amazing organization that really looks at not only maternal mental health, but they're really also starting to look at paternal mental health as well, and understanding how dads are impacted. So they have virtual groups, they have all different supports, again, a resource list throughout the country of how to connect moms to help, in addition to, lots of fundraising and research and professional development. So they are the gold standard.
Okay. And if people want to make a referral or directly contact you or the Guidance Center, how would they do that?
You could reach us either by looking on our website, which is northshorechildguidance.org. You can also call the main office and ask to speak to the intake department. We treat these calls as emergencies. So if you indicate that this is a maternal mental health call, you will be getting a call back immediately. And we'll speak to you over the phone to try to assess what the needs are. And going forward with an appointment usually happens, it can happen within a day or two. That number is 516-626-1971. And the office is located in Roslyn Heights, but we do this work in our different offices. And again, we're all providing virtual services right now.
Okay, well, I want to thank Vanessa McMullan for being on the program today. This is
Thank you.
Guidance Center Perspectives on Pandemic 2020, and we've been talking about postpartum and the pandemic. So thanks so much, and we'll see
Thank
you
you.
next time.
Okay, take care.